When you're completely committed to caring for the heart, it shows.
You'll see in Arkansas's largest group of cardiologists.
And recognize it in the state's most experienced heart surgeons.
It's reflected in the skilled nurses and the latest technology.
In hospitals staffed with all the other specialists that heart patients need.
They put all their hearts into caring for mine.
St. Vincent Heart Clinic Arkansas and the Jack Stevens Heart Institute.
And now, the Heartbeat from the Jack Stevens Heart Institute at St. Vincent.
In today's St. Vincent Heartbeat, we're going to take you inside one of the operating rooms where doctors are performing a heart valve replacement.
The patient, a 69-year-old Arkansan whose family doctor may have saved his life. Here's caregiver for us, Jancy Sheets.
I feel like that I'm in extremely good hands.
A remarkably calm and confident Richard Robertson, just a few hours before his scheduled open heart surgery. 3 weeks ago, he was diagnosed with aortic valvular stenosis, which affects about 1.5 million Americans.
I noticed that I was having a great deal of shortness of breath. I went to my family physician and he listened to my heart, or they discussed, and he felt like that there was something wrong.
Today, Robertson is having an aortic valve replacement as well as a graft replacement of an enlarged ascending aorta. His surgeon, Dr. Fred Meadors.
It's more common that patients that need aortic valve replacement also need replacement of the ascending aorta to prevent a very serious and sometimes fatal condition called aortic dissection from occurring.
Many are familiar with aortic dissection after the death of actor John Ritter in 2003. Without an aortic valve replacement, studies show 50% of patients will not survive more than an average of 2 years after the onset of symptoms. Once diagnosed, though, aortic stenosis is highly treatable.
The success rates are quite high in good risk patients. I mean, the survival rate's in the 98+% range. For this to replace the ascending aorta, ordinarily we do a full sternotomy incision in the front of the chest. It can be done in selected circumstances through a limited upper sternotomy. There's always a risk of bleeding or infection, but actually what we tell the patients is that the risk of not having the surgery for severe aortic stenosis is much higher than the risk of the operation itself.
The surgery usually takes about 2.5 hours and requires about a 5-day stay in the hospital. For today's St. Vincent Heartbeat, I'm Jancy Sheets.
And an echocardiogram is the primary test used to diagnose severe AS. We're happy to report everything went great with Robertson's surgery.
That is some good news.